Let's see. My name's Antonia Chovica, and what do I do here? I work with a team of interns and postdoctoral residents, and we see patients that come to see their medical doctor in one of the clinics, and all of the patients get screened for depression, anxiety, trauma, substance use, and if they test or if they get screened positive, then one of our team members will go and meet with the patient and provide therapy or connection to other services if they need more. Dr. Hagigi is one of our brilliant postdocs, and so she'll talk about her role too. Is that pretty good as far as our
questions and just all of those points?
Yeah.
If you can kind of just reflect it, and then we'll let Dr. Stevie do the same.
Okay.
On those points, yeah.
What led me to choose this discipline? So I wasn't really sure what a psychologist would do when I wanted to start being a psychologist. But what I wanted was to understand what people think, how people think, and what makes them make the decisions that they're making. And so that's what drove me through college even. And I like to read when I was younger, so I would read all these books about interesting characters. And so trying to understand people is really what got me very interested in psychology. As far as completing my degree, so for psychology, you have to go to college, and after college, you do graduate school, which is anywhere between 4 to 6 years. And during that time, you work on a doctoral dissertation. So once you're done with your dissertation, you do an internship, which is kind of like a residency for medical doctors. And so those are the interns that we work with over here. And after your internship, you do a postdoctoral residency, which is what Dr. Hagigi is doing. And then you get licensed, and you're on your own. What do I enjoy most about the work that I do? I love working with trainees and seeing their journey and how they develop into the professionals that they are. I also love creating programs, and with the help of Dr. Flowers, we've done some of that, and we have plans, hopefully, for more. Just so that mental health can be accessible to as many people as possible. A lot of the patients that we end up seeing here, they would never seek out mental health services on their own. So being included or integrated with the medical health component has been really helpful to be able to address these other difficulties that they may be having, emotional, social difficulties. And what would you tell your younger self? Okay, so for some reason, and I know that a lot of people do this as well, it seems like you have to hurry and rush through all your education and get to the end of it really, really fast. And I would say don't rush through it. One of the best things that I've done in college was to take a year study abroad, and so I got to study art in Florence, Italy, and then I also went to Russia for another year. So I would say don't rush through your education, learn about the world as much as you can, and just really enjoy what you do, because once you're done, you don't have the luxury of doing those things anymore once you have to start to work.
Hi, y'all. This is so exciting. I wish we had this when I was in high school, but I'm happy for y'all that you do. My name is Dr. Hagigi, so this is my lovely supervisor, Dr. Chiuvika. And as she mentioned, I'm a postdoctoral resident, so that just means that I am not yet licensed as a psychologist, but I finished all of my degree and all of the other requirements. So I am really excited to be here today because I don't even know how to describe my role or discipline because I feel like one of the coolest parts about this job is all the different things we can do. I think before I did this, I had a snapshot photo of what it meant or looked like to be a psychologist, which is you sit on a couch, somebody sits on a couch across from you, and they're talking, and you're telling them whatever it is you're telling them. But in doing this job, I've realized there's so many different places that we can find ourselves in this field. I've gotten to work with some of our medical clinics and provide support to women who are pregnant, people who are at maybe the later stages of their lives in palliative care, all different medical specialty clinics. And I was like, wow, I didn't know I could do this. And here we are. In terms of my educational journey, as Dr. Chiuvika mentioned, you complete a 4-year bachelor's degree, and then to become a psychologist, you need to do a doctoral degree. So whether that's a PhD or a PsyD in psychology. And then I think I already said what I like most about the work I do, but what I wish I could tell my younger self is what I really urge for all of you is that I always was really intimidated to reach out to psychologists or people in the mental health field in the community to find out what do you do? What does a day look like? I didn't know any, and I would tell myself, well, I don't want to bother them, and maybe I can just Google it. But I realize now how exciting it is for us when people are interested in this field and they're really curious about what is it that you do every day. And so I wish I knew then that on this side of things, people love sharing their experience and story, especially when somebody is just starting the journey. So if you have even a little curiosity about the mental health field, I encourage you to reach out to, even if you're cold calling random people on Google, hey, I'm just curious about your job. I think you'll find that in most cases, we love that. So definitely ask all the questions. Nothing is obvious. But yeah, so thank you.
All right, hi everybody. My name is Gunter Wunderlich. I'm a social worker here at RUHS Medical Center. I just wanted to introduce myself. I'm actually a graduate of Centennial High in Corona, California. I graduated about 10 years ago, so you can tell how old I am. For my educational journey, I'll just kind of do a chronological way with my life. I actually moved to Las Vegas to get my bachelor's degree in social work, and then after that, I decided to get my master's degree at the University of Reno. I practiced as a social worker in Las Vegas for about 2 years before deciding to come back home to my hometown and decided that, maybe I want to get a government job and become a public servant. I want to give back to the community. There's a lot more resources here at the county hospital than you would if you went to a for-profit hospital. And been here for almost a year already, and I'm not disappointed. I actually love it. I actually feel like it's fueled my passion for social work. So let me describe what social work is. I actually gave you guys all a handout. So you'll see that there's 4 different little colored circles there. So you're going to see orange is going to be the emergency room social worker. You're going to have purple, which is outpatient behavioral health. Typically, the outpatient behavioral health is mental health therapists. So they're the social workers that are either working on licensure or they already have their licensure. They do a lot of mental health diagnosis and talk therapy, along with other case management in case they need some psychiatric medications. And then you have the green, which is going to be our PCLS team. So that's our psychiatric team that we have. They're a counseling service that we utilize for a lot of the patients who come in here on a legal hold and that need some adjustment with their psychiatric medications. Those social workers are a little bit different. They don't really participate with discharge planning on the inpatient admission. And then my role is the blue one. So I am part of the inpatient social work team. We do a lot of discharge planning. And if you look on our role, we'll have psychosocial assessments. That's typically what we do on a day-to-day basis. We like to assess patients, see what kind of resources they have or resources that they're going to need. We conduct something called an SDOH screening. So SDOH means social determinants of health. And what social determinants of health is, we like to evaluate their housing, we like to evaluate transportation needs, mental health needs. Sometimes they do have substance abuse or alcohol use. And the sad one is intimate partner violence. Oftentimes we do have a lot of patients who do come here and they're not in the best condition, physically or mentally. And so as social workers, our job, it's very important to provide emotional support. Sitting down with people, talking to them, sometimes trying to just get rid of that point of authority where social workers know we're just people. Let me talk to you. Tell me what's going on in your mind. Sometimes we could be there for 5 minutes, sometimes we're there for an hour, but we do what we have to do to make sure that our patients feel comfortable. And then another thing we do is linkage to the community resources. We work a lot with the homeless shelters, domestic violence shelters. We work with the welfare, which is called the Department of Public Social Services. They have an office here in Moreno Valley. They also have one in Riverside as well. We work a lot with them to make sure we get the patients their insurance. Sometimes they need food stamps. Sometimes they need some vouchers for housing, which is actually very limited given the state of the economy. And then we also do some cool investigative work. So if anybody likes to do investigative work, social work is there for you too. We like to identify John Does or Jane Does, so patients who come in here and we don't even know who they are. We do a lot of backtracking. We collaborate with Riverside sheriff officers that are on site. And we also just look at the chart, see where they came from, try to call the businesses, hey, do you know these people? And then another one that we do that I enjoy, this is my favorite part of the job, is locating next of kin. So we do have a lot of patients who come in here that have needs, but then they're unable to speak for themselves, right? And so we have to locate family. So there are times that I would talk and I would find family in different states. It's the most fun thing ever. And other duties is assigned. Sometimes social workers, we just have to fill in the gaps with communication or just do whatever the care team needs us to do in order to get these patients discharged safely. The patients come in here, they're in a very vulnerable state. They need a social worker for a reason. So we just try to address that need no matter how complex it can be, and then we get them to where they need to be. And one thing that I really do love about this job is how rewarding it can be. It's a very fulfilling career. It is very difficult. Every day is very challenging. And that doesn't matter where you work. You could work here at this hospital, a different hospital. You can work in either CPS, which is Child Protective Services, Adult Protective Services. It's hard work. But when you perform those miracles and you're that person that saves that person's life, or is just that support system that they never had, that's the most rewarding thing. And I go home and I could sleep at night knowing that I impacted, even if it's just one person. Even if it's just one person. I like to operate, my philosophy is the starfish theory, right? There's a story where there is a lot of starfish that are on the beach. And this one kid throws him back into the ocean. And somebody said, you can't save them all, but I saved this one, I saved that one. And then if you tell them to pay it forward, you could create an entire web of change. Because that's what social work is. It's to be an agent of change and to make a positive impact on people, and then thus it will end up snowballing into the community. So one thing I would want to tell my younger self about career in healthcare is you will never be bored. If you're somebody that gets bored with repetitive tasks, doing it every day, working in healthcare in general is something that is going to stimulate you and keep you sharp. And I never had this in high school. When I was in Centennial High School, I never had an opportunity to be able to come to different government agencies to see what the opportunities out there in the real world were. Now, for social work, just wanted to let you guys know you do have to have a master's degree when you do come and work in a hospital setting. If you decided to work in, let's say, adult protective services or child protective services, you only need a bachelor's degree. So just wanted to let you know my educational journey to get here was 7 years. I also have a case management certification that does help out with discharge planning, but it's not required for social workers. Did want to let you know that we do have the option to get clinical supervision hours if we decide to become a licensed clinical social worker, but it's not necessary for this job because we're not really doing diagnosing or talk therapy. That's why we have the psychiatrists or we have the psychologists that are on site, and I feel a lot more comfortable knowing someone with a doctorate does that rather than, me, a social worker. I did put on there as well, we do have our pay scale on there. I wanted to be very transparent about how much social workers do get paid. When you want to look into getting a career in this kind of economy, it's very hard to buy housing. It's very hard to just live. I wanted social workers to be aware, or future students thinking about social work. But because of cost of living, that will increase. 10 years ago when I was in high school, my supervisor told me she got paid only about $20 an hour. So the starting wage went up about $12 an hour. So by the time you guys get done with your career or with your college and you start this career, it's going to be a lot higher. Possibly you guys might start off at the high end that's on that pay scale. All right.
Annabelle,
Yes.
welcome.
Thank you. So, my name is Annabelle, and I joined case management 2 years ago. And after a year, I get my certification in case management. So, just to kind of like introduce to you what case management is, there are two kinds. I'm with inpatient, and there's another side of case management that takes care of billing, because we have to get paid of the services rendered as well, right? So that's the utilization review of case management. So what does case management do? So what we do is actually really collaborate with the team. So a lot of our work is mostly collaboration. Sometimes you will receive calls from family of things that it's just like, hold on, I don't think that's mine, but because you collaborate with the other members of the team, then you direct them to whichever department that could help, that could best help them. So we collaborate with the team. And when I say the team, these are the team of doctors. We have a lot of health teams here. We have general surgery, we have internal medicine, we have ortho team. So medical team, and then in my team, I also have what we call a discharge planner, because as Gunter is saying, our work is involved with discharge planning. And we also collaborate with social worker, which I will explain later on why do we need all this entire team to be able to transition patient to the next level of care. So that's basically, so the primary function of case management really is collaboration with the team to make sure that we transition patient to the next level of care. So when we transition patient to the next level of care, it could be a higher level of care. That would mean that the care that they come here for is the care that we could not provide. So we assist them to transfer to a higher level of care. These are specialized care. Maybe they need more cardiac care that we could not offer here. Or maybe this is a pediatric patients that we are not specialized or that we could not provide, so we transition them to higher level of care. And most of the inpatient case management work is transitioning them to lower level of care. We wanted patient to get better and go back to the community. So lower level of care, we start first, if they're here in the hospital, an example of a lower level of care is either we transition them to what we call a long-term care facility, and this is a type of a care wherein patients would need higher or need specialty respiratory care that would end up in a ventilator or in a trach for them to be able to breathe. Or maybe these are acute inpatient care facility wherein they would require more intensive physical therapy so they could be back on their feet again and do their usual daily activities of daily living. So intensive physical therapy that in acute hospitals, acute inpatient rehab would require for them to tolerate at least 2 hours of physical therapy of 2 disciplines. And then another lower level of care, for example, is a skilled nursing facility. Maybe a lot of you have heard about nursing home, and we think nursing home is just a place where you stay because family could not take care of you. There is another side of a nursing home, and that is the rehab center. So if there is no help available at home, we transition them first to a skilled nursing facility. That way, when they get home, they're more ready. And if they're already very ready, then we transition them to home. And if there are services that they would need, such as home health services, we arrange them. And then if there are medical equipment that they're needed for home, then we also arrange them. So transitioning them to a lower level of care, we do a lot of that of collaboration because we have to ensure that the transition is a safe transition, and that we discuss with the team. So we cannot just send patient because, oh, you're done here. It has to be appropriate, and for it to be appropriate, it has to be a safe discharge. And that's what the work of the case management is working on. And sometimes there are some psychosocial issues that we encounter. That's why we collaborate with social worker. Like we want to discharge to home, but we don't have enough help at home, or there are some issues like we have families. There are some family issues that we really could not help, but sometimes get involved because the safety of the patient is involved. So we collaborate with social work for that. So what led me to become a case manager? So I just joined case management 2 years ago. How I wish I've joined sooner, because it's my passion for teaching and education. So I've really growing up, I wanted to become a teacher, but here comes my dad telling me that no, you could still become a teacher, involved in teaching, but you can become a registered nurse because you have both teaching and a financial opportunity. Good thing I listened to my dad that it doesn't mean that I became a nurse that I could not anymore do my passion for teaching. I enjoy both, and I enjoy it both in case management because you have a lot of teaching and education with your families. What's my educational journey? So I actually studied my Bachelor's of Science in Nursing in the Philippines. So I'm just gonna touch base a little with that because I don't know if some of you would consider international studies. We do have a lot of international students there that they finish their degree and then come back here and pursue their careers. So Bachelor's of Science in Nursing in the Philippines is a 4-year degree course. After your 4 years, you have to take the licensure and become licensed. So I took it in 1993, so now you will know my age. Took the boards at the same year and get licensed in the same year. And then my first job I started with a clinical instructor. So I was so inspired that I want young nurses to become also a nurse like me. So that's my first job, and I always carry on with me and just really become so passionate helping people. And then after that, after my education in the Philippines, how did I end up in the U.S.? Because again, getting inspired with my dad to explore more financial opportunity. So that's why I get in here. So for an international studies graduate, you have to go through another exams to get into the United States if you want to practice as a nurse. So there is what they call a commission on graduates of foreign nursing school. That means you have to take another licensure exam to make sure that your curriculum that you finished outside or internationally is equivalent to what we have here in the U.S. And then you get licensed as well, so you get another licensure exam to become a registered nurse in the U.S. So it's quite a journey. So if you want to consider it, that's something you can look into. They said it's a lot cheaper to do that, but again, there is a lot of licensure to be finished or you have to take again to be able to practice registered nursing in the United States. And then on top of that, because if it's an international school, you have also I also have to take both written and spoken English, and you have to pass it as well, just to make sure that people would understand you when you do your teaching, correct? So that's my my educational journey. So what do I enjoy most of my job is because I get to enjoy in nursing. You have a lot of variations. It's not just if you are not the person that is like most bedside nursing. If you're a registered nurse, there are so many jobs that you can land on. Either you do bedside, you do education, or you can do what they call admin. You will do hospital administration as a nurse. So that's what I like with my job. So going back, what I want to tell my younger self when I was, if I have to go back and just do a little flashback. So what I want to tell myself is, when you're young, like feel yourself. Like grab every opportunity to make yourself better. If I were younger back then, I would have wanted to explore all the specialties in nursing if I could. Do surgical, do medical, just do all of it to become better. Like, so that later on when you're already at your later age, then when you decide like, oh, I don't want to do that anymore, it's too late to learn new tasks when you're already at that age. So while you're young, equip yourself, don't be afraid, because there's always a beginning. But if you're open to learning, everybody starts from beginning, right? Everybody starts from nowhere. So don't be scared. Explore, get into all this specialty and become a well-rounded person. And then later on, it's just easy for you to say like, oh, I'm done with that, I have done that, let me try this. And it's easier for you to do it because you have equipped yourself from the very beginning. That's all. Thank you.
Thank you. As we got some folks who want to come up and introduce themselves, some leaders in the back, but one thing that I've heard a couple of people talk about, and I want to make sure our teams know it, is discharge planning. So kind of break that down for a high schooler. What is discharge planning?
So discharge planning, when we say discharge planning, that means we discuss with the family from the very beginning. So the moment they walk into the hospital, we tell them, what is your plan in the future? Like, what after this, after your hospitalization, what is your plan? So we explore with them, what are the resources at home? If they say like, oh, we want to go home, but sometimes home is not always a safe place to discharge. So it is an ongoing, so all throughout their stay, all throughout the continuum of care, we always communicate with family, like this is what is happening right now. So let's revisit your goal of going back home. Because you could not walk and you would need 24-hour care, is a family there all the time to take care of you? Because if not, then maybe we need to revisit the goal so that your discharge plan will be a safe discharge plan for you. So that's discharge planning.
Perfect. So what we have some of our wonderful leaders are on your desk. Could you guys come up and introduce yourself?